Hello and welcome to the 3 Key Assessments webinar. My name is Shayna Rouse and I will be facilitating this webinar. If you have any questions during the webinar or need any technical assistance, please type your questions in the chat box. Please be considerate of our speakers and mute your phones during the presentation. Today we have a webinar by Paige Rogers on the 3 Key Assessments. Paige is a health educator and part of the community health team for the upstate region of DHEC. She has been with the agency for 21 years and works primarily in the counties of Spartanburg, Cherokee, and Union. She received her Master's of Public Health degree from the University of South Carolina and is CHES certified. Please welcome Paige Rogers.
Thank you, Shayna, and welcome to everyone on the call. Appreciate you joining us today to discuss the 3 key assessments. They are on the map slide here. You can see the Community Health Snapshot, Community Voices, and Forces of Change. And these assessments are based on the MAP framework, which stands for Mobilizing for Action Through Planning and Partnership, and created by the National Association of County and City Health Officials. So I'd first like to start talking about the importance of using multiple assessments and the benefits of what you get from that. And to illustrate that, I'd like for you just to look at this slide, and you'll see some very typical health assessment data. And in this particular community, 64% of the adults are either overweight or obese. So a very common intervention that might be considered would be to target employees in a worksite situation so that they may become better informed and skilled at improving their diet and physical activity. So this particular type of intervention would be supported by CDC, and there's certainly ones that are cited as being evidence-based. So this would be a very reasonable type of intervention if you wanted to tackle obesity. But just with this one data point, the 64% of adults are overweight or obese, you are not really getting at the condition of why obesity exists in the first place. So if you look at this next slide, suppose that you looked at your Community Voices assessment, and if you learned that while there are great assets in the community, they already have existing sidewalks, walking trails, bike trails, etc., but you hear from the residents that they do not feel safe. So these great assets are there, but folks are not taking full advantage of them. And then if you take your Forces of Change assessment, you learn that economic development is a priority in this community and that there is legislation impending that has occurred and is creating some funding opportunities. So now you know a bit more than just the prevalence of the obesity. You can also consider the community's perception about safety and also consider some upcoming economic development opportunities. And in taking all 3 of those into consideration, you might determine that another type of intervention is more effective. And the one listed here is that the Community Coalition secures federal dollars and works with residents to improve the safety and accessibility of public parks and recreational facilities. So while the Worksite initiative is a good one and certainly may help address obesity in some cases, this more focused intervention is really relying on different types of data gained through the other 2, which would ideally allow for the intervention to address one of the underlying reasons why obesity exists. In moving forward, I'd just like to ask you to just reflect for a minute about if you've had an intervention that was not as successful as you thought it could have been, just to think about whether or not having more comprehensive set of assessments may have changed that approach. here are, again, the 3 key assessments listed, and they are modified and adapted from the MAP framework, and they are presented in the Healthy South Carolina Initiative Community Engagement Toolkit, which we'll mention a little bit later. So the assessments really don't have to be done in any particular order, and the way that you'll approach them really will depend on several factors, one of which is the existing capacity in your community. But again, as illustrated previously, it is important to complete all 3 of them because while they each provide unique and important information, it's the collection of the information from all 3 that can help you generate a more complete picture. So again, I'd like to pause here and just hear from you folks, and I'm just wondering if you have ever participated in an assessment process with a yes or no, or you're not sure. And if you just click there, I'll be able to see who's in the audience and what sort of experiences you've had. So it looks like about half and half really have and have not. I know we've got quite a few DHEC folks on the phone, and I know that they are probably all very familiar with this assessment process. But I just invite you to use your experiences. It may not have been a MAP assessment or a health assessment even that you've done, but to use your experiences in thinking about this particular information we're going to share today. So beginning with the community health snapshot, once this is completed, you will have answers to these questions. How healthy are our residents? And what does the health status of our community look like? So the result of this assessment is a strong understanding of the community health status as portrayed to qualitative data. So during this stage, specific health issues and conditions are identified. For example, like the high prevalence of obesity we mentioned earlier. And a broad range of data can be collected and serves as the foundation for analyzing and identifying health issues, and also to determine where your community stands in relation to other peer communities or with other states in your state or in national data with other states. In this process, there are a few typical steps, and of course, again, these will vary depending on the particular community. But just generally speaking, in collecting your data, it's important to convene a broad representation of your community, one that can represent all different segments, and also to include the entire local public health system. So some of your key stakeholders might be foundations, organizations like the United Way, who typically have funded community health assessment work. And hospitals are now required to complete community assessments, so they're also a good partner to consider. And if you're not from the health department, assessment is one of our 3 public health core functions. So you can likely find some folks within your local health department who have some capacity and expertise to do some assessment work. So really just think about all those who might have an interest in collecting health status information, and these are the types that should be convened and engaged in this particular part. Next, you will look at the particular indicators that you want to focus on, and you really need to work with your group and determine which ones are meaningful in your community. So there are many, many different sources of data. We certainly couldn't include them all. So again, important to have some dialogue with the folks in your community to collectively determine what's important to them. In terms of identifying existing data sources, again, there's just a wealth of data out there. So you don't want to reinvent the wheel or duplicate previous efforts. So it would be important to take a good account of what is already there. And also, if there is data already there, look at the strengths and weaknesses of that data to determine whether it reflects what's truly going on in your community. For example, you might find some data that just is very, very outdated. We know our data lags behind anyway, but some of it is lagging more than others. Once you do that, you can then take note of what you don't have and figure out if there's a way to gather your own data. And this might be where surveys come in, or you may work with partners to supplement already existing data. Finally, you would need to organize and analyze the data. This can be a bit overwhelming, so you might want to consider enlisting help from someone who has some skills in synthesizing and analyzing data and who is skilled at putting it in a reportable format. For my example, in my community, one of our colleges actually manages the data for our United Way critical indicators process, so they are very willing and helpful when we are collecting and analyzing our data. Another thing to consider here is that part of this involves establishing an updatable monitoring system so that ideally you're not just doing this as a one-time activity, but to think about a system that can be easily updated so that you can look at trends over time. And finally, although not listed, it's important to determine how you're going to share this information with your community once it's completed. So this is really just a quick overview, and obviously there are a lot of details involved in each one of these steps. In terms of what kinds of data to collect and where to find it, on the left side here I've listed several categories. That is not to say that you need to collect all of this, but again, it's important to have some conversation with your partners to learn what it is that they're most interested in. And then on the right-hand side, there's some examples of already existing data. DHEC, of course, has a ton of data, as does the South Carolina Budget and Control Board, Office of Research and Statistics. Hospitals, as mentioned before, are required to collect data. And then you may identify some local partners within your community who collect their own data. There are also some federal databases. For example, the County Health Rankings is a report that collects data from counties across the country. I was going to say again, I've gone through this very quickly too, but there is guidance available to you through either the MAP website or by consulting the Healthy South Carolina Toolkit. And again, we will give you those resources so you can find that. Moving on to the community voices. In this assessment, you're gathering thoughts, opinions, concerns from community members, and it leads to a portrait of the community as seen through the eyes of its residents. And you will be answering the questions, what is it that it's important to our community, and how is quality of life perceived in our community? So listening to and communicating with community is essential to any community-wide initiative. The impressions and thoughts of community residents can help pinpoint important issues and even highlight possible solutions. And most importantly, by involving the community and truly listening to their concerns, participants feel like they are an integral part of the process and will will more likely take ownership in the process. In terms of steps, they're a little bit more general here because this assessment really is more qualitative. So, with input from your community, you will determine the most effective approaches to gather information from a cross-section of the community, and you could do surveys, you could do forums, you could do key leader interviews, as well as focus groups, and there are tools available on how to do all of these in the toolkit as well. You may want to use one of these, or if you have the capacity to do it, it would be useful to include more than one too. In terms of resources, you may think about meeting spaces, food and drink for the meetings, whether or not you need staffing support, whether or not you need equipment like projectors, and if you're doing a survey, for example, how will that be implemented? Who will develop it? How will it be disseminated? How will it be gathered? And then how will it be analyzed? And you may want to consider gathering information through mechanisms that are already established. So identifying an organization or group that has an already existing meeting time and try to get on their agenda. That is something we've done, and just kind of going where the people already are gathering. And again, once you get that data, you need to figure out how the best way to organize it is and present the data and show it back to the community. The Forces of Change assessment is designed to help participants answer these questions. What is occurring or what might occur that affects the health of our community, and what specific threats or opportunities are generated by these occurrences? And this is really engaging in a brainstorming session that is identifying forces, trends, factors, or events that are or will be influencing the health and quality of life in the community. Again, steps here, you would need to identify a facilitator in a location. You would need to create a list of forces of change and identify potential impacts and threats and opportunities for each one of those that you identified. And responding to these questions really requires a balanced approach. So on one hand, you need to think broadly about events, factors, and trends that represent major forces, but you also need to think about local forces as well. So both regional, national, global concerns even should be considered. But on the other hand, you need to focus again specifically on issues that are affecting your local environment. And depending on how you want to do it, you may do that in just one brainstorming session, or you may want to do that in separate sessions with different folks so you get a broader input. Okay, so I'd like to switch over now and talk about some of the experiences that I've had in Cherokee County. And this is just a little bit about Cherokee County. It's considered to be a small rural county. They have a population of about 55,000 people. They did receive Healthy South Carolina funds, and with those funds they did hire a part-time staff, which is always helpful to have. And they had an already existing community indicators group. So you can see there the categories that they focused on, and public health was one of them. So through that public health committee is where we facilitated this process. And so in the middle of doing all this assessment, we've also had conversations, and we've been able to identify a vision and some values and a mission statement. In terms of our community health snapshot in Cherokee County, we have not created a formal report yet. We're in the process of doing that. But we do have the information collected in a PowerPoint presentation, and we have shown that a couple of times to a couple of groups. You can see there on the right, these are just some of the categories and some of the information that was represented there. Access to health, chronic diseases, clinical preventive services, infectious diseases, maternal, infant, and child health, nutrition, physical activity, and tobacco. And in the next slide here, I'll kind of tell you why we chose those categories. Within DHEC, there is a section, their biostatistics section, who has already put together some data. So in terms of consistency, I liked pulling data out of there because you get not only the county rates, but you can see the South Carolina rates there, and they also rank those among all of the counties in South Carolina. So it was a way to get just very consistent data for all of those categories listed there on the left side. And I'll put the website information below so you can see where that is, and you can, if you're in South Carolina, you can just click on your county and that particular information will come up. Also included in our snapshot was some external data. I mentioned earlier national databases, and one of those is the county health rankings data. So if you go to their website, you can go to your particular state and then go to the particular county you're interested in and get that information. This does take a little bit of explanation about, how it is that they gather this information. I don't think it's quite, clear just looking at that particular document there, so that would involve some explanation to go with it. Also, I mentioned some of the hospitals are required to do community assessments now, so we did use our local hospital, and they actually approached us to help them do their assessment. So this is just an example of a report where we help them both participate in and to gather other folks to be in their focus group. In terms of community voices, I know this is not really meant for you to read this survey, but I just wanted to show that we did do a type of survey to gather those perspectives, and these tools, of course, are available, as I mentioned before, both in the MAP website and in the toolkit. And the way that we did this was to use our Healthy South Carolina funded individual who really just took these anywhere and everywhere that you can possibly imagine. So we were able to collect 581 surveys, which I think is a pretty substantial number given the small size of Cherokee County, and you can just see the breakdown there. We had primarily 40 to 54 in the age group. We had a pretty good representation on the race and ethnicity. We did have more females than males, and what we did throughout the process is just take a look at the data that we had gathered, and then we would try to sort of target places where we thought we could find some of the missing data. And also what we did is had an intern to input all of this data into SurveyMonkey. So this community really didn't want to try to get people to fill out the survey on SurveyMonkey, so that we used it really just so that we could collect the data and do the analysis once it was over. So I'm going to talk about what came up in Cherokee, but I wondered if you could think about, if you were doing the survey, what do you think would be some of the top concerns that would be raised? Laura, you have listed access, obesity, mental health resources. Yes, those are certainly important ones, and I would say certainly ones that come up almost every time. Mental health, dental preventative services, that's another good one. Of course, dental issues are prominent in a lot of communities, so I would say that that's an important indicator too. And of course, high blood pressure and diabetes and some of those chronic disease issues often come up too. And you've got some good data really with all of these to be able to identify exactly what those problems are. Lack of physical activity, nutrition through the BRFSS data, yes, that's really common and important information to include too. Access to care, that comes up a lot as well. Violence and tobacco, yes, those are important too. I'm going to go ahead and advance to the next slide and show you about Cherokee County. So we asked this question really in two different ways. We asked what was the most important factor for a healthy community, what makes a community healthy, and then we provided like a list where they checked off 5 of them. So you can see safety was a concern, the economy was a concern, low crime, good schools, and access to affordable health care. And then in terms of the most important issues in the community, alcohol use came up as number 1. And I was a little bit surprised by that. I'm not sure why, but and in addition to that, drug use, which those two can kind of go together, came up pretty high too. But overweight and obesity was pretty high, as well as cancer and diabetes. So those folks were certainly thinking about some of those chronic diseases. In terms of forces of change, I, again, don't expect you to be able to read this, but I just wanted to tell you a little bit about our process. We were able to hire a facilitator, and I think sometimes that's a good thing to be able to get an objective person to do that. And you can, well, you can't see, but I'll tell you some of the things that came up there. Tobacco was an issue that came up in the health category, in addition to just the whole thing about healthy eating, unhealthy eating, and lack of physical activity. They had some concerns about whether schools are adequately addressing that. In terms of economics, there is going to be a new Duke Energy nuclear plant, so that will certainly affect things that they're doing there. And also, they've got a big project going right through Gaffney, where they're going to be widening the interstate. So that could certainly have some ramifications as well. They also mentioned, too, about the aging population, which is a national issue as well. But we were able to identify some of those issues and then talk a little bit about what the threats were, but then also to provide some opportunities to each one of those, which, again, is an important thing, not only that you talk about what the threats are, but what sorts of opportunities that might create. So again, I'm going to pause here and ask what your approach might be when you conduct an assessment in a small community like Gaffney, as opposed to a different one, which is in a more metropolitan-type area. If y'all could type in there on the right side some of your ideas about that. I think there are different ways to do that depending on the size of the community. LaVonda, I think that's a great suggestion to identify a gatekeeper. And in a small community, you could probably identify less of those. In a larger community with different sectors, different geographical areas and whatnot, you may have to get, a collection of those folks. Finding faith-based organizations that already have an impact is an excellent opportunity, really whether being in a small or a large. Again, looking at your local civic groups, there may be more of those in a larger community, so it would be important to tap into that. And Suzette, I think you're correct in saying that if you identify your community champions, you can use them to get your information out to the different sectors in the community. So again, just thinking through what might work in a particular county. I felt like, because I've done it in both, I think it's easier in a smaller community. I think in a larger community, folks are kind of off doing their own thing sometimes, and just in my experience, maybe a little less willing to come together as one group. I just think logistically that's difficult. Whereas in a small place, usually you see pretty much the same folks at pretty much all the meetings, so it's kind of easy to, gather those folks together to help you get your information. So thank you for that input. Another question I'd like to hear from you about is, what barriers do you think you will come up against when you're doing assessments? It's certainly not an easy process, but there are some definite challenges. I'll just give you all a couple of minutes so that I can see some things on the screen here. Okay, that's a great point. Are you really getting the accurate depiction of your community? So there may be segments that you're not able to reach, don't know how to reach, you haven't been able to identify a key stakeholder. That certainly can be a barrier. In small communities, people tend to be a little hesitant to share information with strangers. That is a great point. They kind of are wary to have quote-unquote outsiders come in and do things with their community, so that certainly is a barrier. It's not easy to get participation from everybody. That's certainly a barrier. Always have turf issues coming up. People show up but expect others to do the work. I know some of my DHEC folks can rely on this to happen. Sometimes we don't necessarily want to be the front and center and the leader. We certainly would love to have some folks, local folks in the community to do that, but they just don't always feel comfortable or don't feel like they're able to do that. So that is a particular barrier I know that we deal with quite a bit. Again, Lydia, like yours, people on the volunteer list that are the president of the organizations, but they don't have the time to work, and they typically are the ones that you really need their input, but they're not always the ones that come to the meetings. Okay, that's great information. Thank y'all for weighing in there as well. So, given all this information, is there anything that you learned today that you think you might like to implement in the future? And I'll just say here that you just really got a little snippets of information about this, but again, to emphasize that there are just a wealth of tools available to you so that you can get more information on how to do some of these things. Using all three assessments for a complete picture, yes. Thank you. That is a point that I was definitely trying to make, and again, I think it's one that's really important. Regarding the last one that just came up, how you do assessments, again, there's plenty of information on how to do these, as well as what folks you need to bring to the table, and how to do all that visioning as well. And a great point, Denise, about thinking about who you need to bring to the table before you do the assessments. And once again, there are tools that really have a list of folks that you might want to consider, so that makes it an easy way to do that. I've mentioned the NACHO MAP process and also the Healthy South Carolina Initiative Toolkit. These are the links to get to those. Again, just a wealth of information in both of those. The toolkit is currently being revised and should be available by the end of the month. So that's going to be a bigger and better resource. But again, that is taken from the MAP process. So there, if you're in the toolkit and just find that you might want some additional information, you can go to the MAP website and you can actually see examples of what folks from all over the country have done. So you may be able to obtain some good ideas that way. I think that this is my last slide. I just say that y'all are certainly welcome to contact me anytime. I'd be happy to share any information with you or try to point you in the right direction to get what you need. So I really appreciate you folks being on the phone. And again, feel free to contact us if you need any other assistance.
Thank you, Paige, for joining us today. I appreciate you taking the time to share your experiences, and thanks to all the participants for joining today. If you have any questions concerning the webinar or the assignments for the course, please don't hesitate to contact me. As a reminder, Part 2 of this course is now open for participants to enroll if you are interested. And if you could, please provide some feedback in the chat pods about what went well, suggestions for improved virtual meetings, and any other comments that you may have. And thank you again, Paige, and thank you again, Esther May. Do any of the participants have any questions for Paige? If so, you can type those in the meeting chat or unmute your phone, and she would be glad to answer any questions you may have. Thank you. That concludes our webinar for today.